Hello, I'm Peg Bulgioni, Communications Specialist with Rutland Regional Medical Center, and I'd like to welcome you to Window on Wellness. During our program, I will be doing a walkthrough with Tammy Birdsey, Supervisor of Diagnostic Imaging, who will be showcasing the newly installed 3D breast imaging machine. I will also be speaking with Dr. Dan Mitchell, Director of Radiology, about the benefits of 3D mammography. I will be right back after this message from Rutland Regional Medical Center.
Welcome to Rutland Regional Medical Center. We are Vermont's largest community hospital with 37 specialty clinics. Healthcare organizations have always fixed people once they're broken, but at Rutland Regional Medical Center, we do more. We provide nutrition counseling, weight loss help, smoking cessation classes, all the things that help the community and individuals stay healthy. And we do it all with this promise: to listen, to respect, and to care, always.
Welcome back to our show. I am in the Diagnostic Imaging Department here at Rutland Regional Medical Center, and I am with Tammy Birdsey, who is the supervisor for Diagnostic Imaging. And Tammy is going to be showing us the new 3D breast imaging technology that is now available at Rutland Regional Medical Center. So Tammy, hello.
Hi.
Welcome to the show.
Thank you.
Glad you could be here.
Thank you.
And I guess we'll start with what is unique about the 3D breast imaging technology.
Well, tomosynthesis or 3D imaging takes a series of images of the breast which allow the radiologist to see through the different layers in the breast. This gives them a lot of information and gives them the ability to see through overlapping tissues. This technology also helps reduce callbacks, which is when a woman has to return for additional imaging, which will help decrease the patient's anxiety.
So Tammy, why don't you explain what changes have been made in this particular room around, just the mammography experience for the patient?
Our new rooms have been designed to provide a private and comfortable experience for our patients. They've been done up in calming colors to help soothe anxiety. They are larger and they have a curtained area here which allow the patient to change privately without ever leaving the exam room.
And is there any other changes that have taken place? I mean, with the flooring or anything?
The flooring is the same. We have taken GE's advice to provide the lighting and the coloring in our exam rooms. We have the lighted wall behind to kind of relax our patients as they're having their exam.
Is the space bigger than the previous space that was here?
Yes, both rooms are bigger, which give the patient a little more space of their own.
So Tammy, how would this type of technology encourage more women to get mammograms?
The new GE Pristina was designed to increase the comfort of the exam for the patient. It has rounded edges, it has a thinner design which allows the patient to get up nice and close. They replaced the handles with lighted bars for the patient to rest their hand on rather than grasp. This making the patient more comfortable allows the technologist to concentrate on getting the best images possible for the patient. That in itself will help reduce anxiety for your patients.
Is the compression still the same?
The compression is the same.
Okay, but it sounds like the technology, I mean, everything else is just much better and more improved.
Yes, the basic process of the mammogram is the same. The breast is still compressed while the images are being taken. But the design of the machine and the new rooms do help make it more comfortable.
So Tammy, why don't you kind of do sort of not an actual simulation of a mammogram, but maybe explain the process, maybe for someone who's never had a mammogram, and they're coming into the room, what takes place?
Okay, our patients enter the exam room and they'll come and change right in the exam room behind a curtain, so very private. And in this same exam room, the technologist will review the patient's history and their information and get some information on why they're having this or what they're concerned about. When they actually have the exam, this machine moves over their head, does not move or affect the patient. It is a little more streamlined because as soon as they're done, they get changed and they're done.
Okay.
There's no delay.
And how long does the process take?
A mammogram is scheduled for 15 minutes.
That's a short amount of time, for something that's so critical.
Correct. It does not take a long time. The new technology makes it so we get so many images and so much information that it's a quick and easy process.
So right now I have with me Dr. Dan Mitchell, who is the medical director for the radiology department at Rutland Regional Medical Center. Dr. Mitchell, welcome.
Thank you.
Thank you for joining us here today. So we've been having this discussion about the 3D breast technology here at Rutland Regional, and I guess I want to ask you first and foremost, what are the benefits of this 3D technology?
Well, it eliminates the problem we used to have of parts of the breast overlapping with each other. So in the conventional two-dimensional mammographic imaging, you're compressing the breast two different directions and seeing everything for the most part, except structures can overlap. Glandular structures in the breast can overlap, and sometimes that can make something look like it grew or make something look like a lump, when really it's just a matter of things superimposed on each other.
Now, I understand with younger women, they have denser
Yes,
breast
in
tissue?
general they do. Yes,
Right.
yeah.
So this makes it much more easy to detect any abnormalities in the breast, this new technology?
It does. It really helps sort things out. So it used to be that anywhere from 10 to 12% of women would get called back after their initial 4-view screening mammogram, and one of the more common reasons we would call them back would be because of things overlapping each other. And so we would call them back, we would do extra views to try to tease that apart and say, oh, okay, there's nothing really wrong, this just overlap with that, and you're okay. And now we've pretty much eliminated that reason for calling a woman back. So now the rate of calling a woman back is 5 or 6% instead of 10 or 12%. And these numbers are all well within the standard accepted benchmark ranges, but it's just a dramatic improvement. If we call a woman back now, it's for a different reason. It might be for little calcifications or for something else that we're concerned about. But
well, it's terrifying, when you get that
yes.
phone call and you have to go back and have another set of another mammogram. So
of course it is, and women lose sleep over it, and we get them in as quickly as we can. But even if we get a woman in the next day, she still had a sleepless night and worried about it and stressed about it, and just for us to say, oh, it was nothing. Well. It wasn't nothing to her.
No.
It was alarming.
Absolutely not.
Yeah.
So, getting back to the 3D technology piece, is it safer? Is there less radiation emissions with this type?
There's less radiation, and so one of the benefits of waiting for this newer generation of technology is that now the radiation delivered by this 3D machine is less than what was delivered in the conventional two-dimensional images. And so we don't have to play the game of saying, well, which woman should get the 3D imaging because it's a higher radiation dose and we got to be really careful with that. We don't have to worry about that. Every woman can have 3D imaging, and it's a lower radiation dose too.
Now, this generation, you said, of this technology, you said it's very unique, or is Rutland Regional one of the first hospitals to have this type of technology?
We're the first in Vermont. We're still the only hospital in Vermont or New Hampshire that has this.
This particular
unit. So everybody who's doing breast care in the area is doing some form of 3D imaging. A large number of them have the earlier generation units. Nobody has, it's called the Pristina. It's made by GE. Nobody else has the Pristina. Pristina is the lowest radiation dose of any FDA-approved unit out there. It's right now the leader in that realm. It also has a superiority rating from the FDA, meaning that its diagnostic images that are really kind of computer synthesized from the 3D acquisition, those are better than the old digital mammograms that used to be done by everybody.
Now, I know that this machine, one of these two machines that you have, was made possible by a capital campaign that occurred occurred
Yes.
last year.
Yes.
Early Detection Saves Lives campaign. So I don't know if you want to talk a little bit about that or.
That was so wonderful, seeing the community come together. And we had a number of different events, and we had people doing outreach, and a lot of work went into that. And everybody just pitched in, and we raised over $350,000, which was enough to buy one of the two machines. It was a huge help, and it's just wonderful to see people come together like that for something that's important.
Oh, absolutely. That's incredible. And Rutland is a very generous
Yes.
community anyway. They really
Yes.
have a big heart. And this is very important, I mean, this is something that will go on. I mean, these machines, I mean, what's the lifespan of these machines? I'm just curious,
Well, I don't have a good number for that. I mean, it's like any other high-tech type of device. New upgrades come, and new upgrades, eventually become the standard. I'm sure these are good for quite a few years with just, the upgrades that come along.
Well, and hopefully when we start doing more outreach and we really talk to the community about this type of technology, hopefully it'll encourage more women who have not had mammograms or who haven't had regular mammograms to come in and start getting regular checkups.
Oh, yes. Oh, I really hope so. The name of that campaign, Early Detection Saves Lives, I mean, that sums it up right there. One of the biggest factors on how a breast cancer will affect a woman is how early did we find it. And screening mammography is the way to find it early.
I know. I totally agree with you. Do you have any final thoughts that you wanted to add, before we wrap up?
Just encourage everybody out there to get a screening mammogram, get them regularly, talk to your provider about your breast cancer risk and what the smartest way of screening for breast cancer is, but there's really no substitute for a screening mammogram. It's the most effective way to find the breast cancers very early, when you have lots of options on how to take care of it then.
Well, thank you very much, Dr.
You're welcome.
Mitchell. Really appreciate your time. That was Dr. Dan Mitchell, Medical Director of Radiology at Rutland Regional Medical Center. And we thank you for joining us here today on our Window on Wellness program. It airs every week on PEG TV, Channel 15, and on demand at pegtv.com.